The rotational hip symmetry test. Now, to have a look at your hip's rotational mobility, we're going to take a look at both your hip internal rotation and your hip external rotation. It's important that we assess the hip, as when the hip capsule is tight, your body will compensate either upstream or downstream of the hip to gain extra mobility. This will lead to potential injuries in other areas of the body over time. Improving hip mobility will also improve your overall performance, because when we have more mobility in the hip, this allows us to generate more torque and use our muscles more effectively. In addition, a lack of hip internal rotation will also limit the depth of your squat. What hip rotation limitations could have presented as in the squat test? So if you're presented with the following issues in the squat test, hip rotation limitations could be the problem. We have pain when squatting, so this will basically be pain around the front of the hip, limited squat depth, a weight shift to one side of the body, or twisting the hips to one side of the body. Now the setup. Set up your camera to video the test from in front, as you will need to look at yourself from the front on to work out your results. You'll need to find a high bench or table for this, somewhere you can dangle your legs freely. Be sure to sit straight up and only move from the hip joint while performing the test. It's quite easy to cheat and compensate through the torso when trying to achieve extra range in this movement. The test. Internal rotation. We will investigate your hip's ability to internally rotate first. To do this, rotate your foot out, keeping your thigh straight. This will put the femur into an internally rotated position within the hip socket. Perform this on both sides, taking note of the angle achieved and the feeling within the hip, i.e. did it feel tight and restricted, and which side, if any, felt tighter. The angle can be measured with 0 degrees representing the leg dangling down and 90 degrees being the bench top. Record your results in the movement assessment sheet in the toolkit, and use the comment section to note down the degrees of rotation you achieved on each leg. Now, external rotation. Next, turn your leg inwards. This will put the femur or thigh bone into an externally rotated position. Perform this on both sides, taking note of the angle achieved and the feeling within the hip, i.e. did it feel tight and restricted, and which side, if any, felt tighter. The angle can be measured with 0 degrees representing the leg dangling down and 90 degrees being the bench top. So record your results in the movement assessment sheet within the toolkit and use the comment section to note down the degrees of rotation you achieved on each side. What to look for in the test. Be careful not to compensate by leaning away from the movement or flexing the back or torso. Ideally, we're looking to achieve 30 to 45 degrees of rotation in each direction. Most people will have less internal rotation than external rotation, but overall, we're looking for a total rotational window of 70 to 90 degrees in order to be able to move well at the hips. This means that your internal rotation plus your external rotation should equal somewhere between 70 to 90 degrees. Ideally, we also want to see symmetry between the limbs, with both having the same range of movement present in the same direction. So what to do? Look back at your videos and take screenshots when you're at the end range in each position. Take note of the angle achieved. If you have 30 to 45 degrees of rotation in both directions, you have sufficient mobility. Or if you have a total window of 70 to 90 degrees, you have sufficient hip rotator mobility. But if you're lacking in either internal or external rotation or have imbalances between the two, you're going to need to mobilize your hips. Please refer to the hip rotator mobility exercises in the corrective exercise section of this course.